All right. Hi, everyone. My name is Cleaver. I'm part of the team here to help guide you and teach you some ultrasound with the eFAST exam. Hopefully by now you've heard from Dr. Flam and Dr. Goodmurphy, both really good mentors of mine, to kind of illustrate the importance, the versatility, and the efficiency that ultrasound machines have been used, in particular the eFAST exam, which this curriculum is all built around. And Dr. Goodmurphy has explained like some basic foundations of the terminology, the knobology, and different types of artifacts that we'll go ahead and see and put to use here in this module. And this module is just the first module of kind of like the meat and potatoes of this curriculum with the eFAST exam. So this one will be the first one with the pericardial view, and we'll go ahead and get started, okay? So in this slide, I've listed out the 5 different components of the eFAST exam. Although anatomically we say that there are 6 views, just because with the second one, the anterior thoracic lung view, which is the next module, you check both the left and the right lungs. So there are 6 anatomical views in totality, but really there are like 5 main key components. And this one's the pericardial view, that if you ever look up the literature or look up some textbooks, they'll say pericardial view. But in actuality and in practice, the pericardial view has different names. Some of them that I'll get into later, like the subxiphoid and subcostal. But if you ever want to look up literature and textbooks, pericardial view for the New England Journal of Medicine is what they go by, okay? So here I've written down the 3 main wordings that we kind of view when we're describing this view, okay? The pericardial view, which we've described before, and then there's the subxiphoid view and the subcostal view. Again, all these 3 main terms are interchangeable. It's really user dependent and it's team dependent, as long as you're able to describe which view that you're trying to look for, and your team knows which view you're trying to look for, okay? I personally like the subxiphoid view. It's more anatomically, I feel, direct when you're talking about, probe placement versus pericardial view. But again, either is fine. Subcostal view means costal meaning ribs, just means that it's going to be underneath your ribs. So here we have and just to orientate ourselves to the basics, this right here is the sternum, and there's 3 main parts. There's the manubrium at the most superior region, the body of the sternum, and then the xiphoid and the xiphoid process, okay? So when we say subxiphoid view, it kind of gives it kind of gives you an understanding that we're going to place the probe right underneath the xiphoid process, okay? And I have that right here on this picture of a body itself. So if you have a moment, go ahead and palpate for your own manubrium, your sternum, and then feel for your xiphoid process. And you should be able to feel a little divot right underneath your xiphoid process. And you can imagine that's where you'll place your probe. As Dr. Goodmurphy has probably explained, the probe indicator should always be on the patient's right. And then you kind of press down, and you're going to have to give a good amount of pressure, regardless of body habitus, and kind of fan superior towards their head, fan superior towards their heart, okay? And again, we'll practice this in person, and you'll get a feel for it. But this is, again, is just to orientate you about, the different types of terms that we use and how that can relate to probe placement directly, okay? So beginning on this side, notice the slide's title change from the pericardial view to my own personal preference for the subxiphoid view. Now that we're all on the same page and we kind of know that the probe is going to be underneath the xiphoid process, fanning upwards towards the heart, you could use pericardial view, but now that we kind of know that it's kind of like the same thing, okay? Unfortunately, this is just to illustrate that the anatomy of the heart, we're trying to get underneath the ribs, underneath the xiphoid process, but the heart is not an isolated organ. So whenever you have ultrasound images and you're looking for the subxiphoid or pericardial view, you will not see just only the heart. So what else will you see? If you can imagine other organs surrounding here around the xiphoid process, you'll probably pick that up on ultrasound as well, okay? And that would be this image over here. So as you put the probe placement around here, you most likely will pick up some liver, maybe some stomach as well, as that's all in that region. And even outside of that, you might see some abdomen, some rectus abdominis if they have like a really strong 6-pack or subcutaneous fat, et cetera, okay? And this is just to illustrate that we'll put the probe here looking for the heart, but we may pick up a lot of other organs, whether that be musculoskeletal or liver, or stomach. Okay. So now let's dive into some actual ultrasound images. Both of these images of the subxiphoid view are normal. Everybody comes in different shapes and forms, and as we do more of these ultrasounds, we'll get better at seeing and identifying structures, okay? The mainstay goal here is to look at the heart and see if it's normal. So let's look at this right image, and it's kind of easy to identify which one is the heart here, right? But see if you could tease out which image or which structure within this image is the heart in this one. If not, we'll walk it through. These are some ultrasound probes icons that I kind of used in the last image to kind of orientate ourselves and kind of remember that we're putting it subxiphoid. We're going ahead and look at superficial structures like the liver, and then as we kind of go deeper away from the probe, we'll see the heart, okay? We see some skin layers on this left-hand side of one here. Let me get this indicator here. And then we also see two kind of circular hypoechoic structures here that some people may have and you will see, and some people may not have. And you can anybody like guess what this may be if it's kind of exactly midline? It would be kind of like some abdominal muscles if your patient has it, okay? Abdominal muscle here and abdominal muscle here. As we go deeper, we see this one big structure right here. That's kind of the same echogenicity, and that would be the liver. Okay. If you can go ahead and see the slide looking back, that you'll see the liver is a little bit more inferior. Therefore, you'll hit it with the ultrasound at the subxiphoid view first. Okay. And then finally, we'll get the heart. Again, as we do more of these, we'll kind of identify these structures a little bit more easy as we do it in person. But again, these are standstill pictures, and once you see the live picture, you can see the heart here, okay? The only organ that's beating, okay? The heart is mainly hyperechoic around with the fibrous pericardial sac and some musculature to it. And then inside is anechoic, right? And that's not abnormal, because inside the heart is blood. Blood is pumping. Okay, so this is kind of what normal looks like. This other image that's normal, the heart's beating faster, obviously. And still, let's orientate ourselves to the probe placement at the top here. And we'll find the liver structure right here. Okay, so that's the liver. A little bit smaller, a little bit more compressed than the previous picture we saw, but still normal and still not the main focus. Okay. And here we see the heart. You can actually see some valvular action going within the heart. You could identify the different types of ventricles. So this is an atrium. So this is right atrium, right ventricle, left atrium, left ventricle. But again, that's not necessarily important for the eFAST exam at this view. But it is important is that we kind of see this hyperechoic, white, bright, fibrous, muscular tissue around the heart, the muscular tissue. And then the anechoic blood, fluid blood within the heart that's getting pumped. Okay. So kind of look at these again, know what normal is, and then we'll go ahead and talk about the anatomy and like why things may be abnormal, why there may be some fluid collection. So let's talk about the anatomy of the pericardium before we talk about, how fluid can collect in it. Okay. So here they kind of zoom in and shows the different layers of the pericardial cavity, one being the parietal layer and away from the heart, and then the visceral layer, and then you have the pericardial cavity in between. I kind of like to think about it as a sac, right, around your heart, so kind of like a Ziploc bag around your heart. And that Ziploc bag around your heart should hold around 15 to 50 mLs or 15 to 50 cc's as essentially like lubricant and protective lubricant. Because your heart is beating vigorously, relaxing, contracting, and that friction could be problematic. So it's always nice to have a little bit of serous fluid within there so that your heart can glide easily as it beats, okay? This is another picture, instead of a Ziploc bag, they kind of put as a balloon, where this airspace would be the pericardial sac, the outer layer would be the parietal pericardium, and the inner layer would be the visceral pericardium, okay? And it's always nice to have a little bit of fluid. The problem is that when you can have blunt trauma, fluid can collect in that. And instead of just 15 to
50 mLs, it can collect to 100, maybe 200, and instead of a Ziploc bag with a little bit of lubricant, you pretty much have a water balloon around your heart that now doesn't help your heart, but your heart has to fight against that water pressure, essentially, okay? So here's another cartoon illustration of the pericardial sac in a problematic scenario. Again, this pericardial sac should have a little bit of fluid within it, again, around 15 to 50 cc's. That way your heart can glide, but in this case, as you can see, fluid or blood can accumulate within the heart and then lead to some dysfunction there. Fluid and blood can surround your heart from a variety of reasons. We don't have to expound on each one. One of them is obviously trauma, blood trauma. Aortic dissections can cause this too. But nonetheless, fluid is accumulating around the heart and leading to problems. And if not intervened, it could possibly, if not spontaneously resolved, it could possibly get worse where you kind of have this entire water balloon around your heart. So instead of lubricating your heart so that your heart can glide, it's more so a water balloon around your heart that your heart has to beat against. It has to fight against, and is placing unnecessary pressure and strain around your heart. If it's blood, then it's blood that's not obviously circulating around your body. And yeah, so the mainstay here is that we kind of saw what normal ultrasounds, pericardial subxiphoid ultrasound look like. And can we identify this on an abnormal ultrasound? Can you identify this on an ultrasound? So let's say you have some patient that's, or some patient that's like hypotensive and looks diaphoretic and problematic and whatnot, and you go ahead and do the first part of an eFAST exam. You place that probe right under the subxiphoid and you see this. Now, it's only been a little while since you've been oriented to what a normal subxiphoid or pericardial window looks like, but see if you could flip back and compare and contrast from that normal slide to this slide right here. Again, orientate yourself that the probe placement will be at the top, right? So you'll see superficial structures, maybe some skin, maybe some abdominal muscles if they have some. And then your first main organ, as we're identifying, that comes in different shapes and sizes, is your liver. And this would be your heart right here. See if you could think about or see if you see anything different. Again, you should have some anechoic fluid, which is blood, within the heart as your heart is beating, hopefully. And then you can see some anechoic fluid that you see surrounding the heart. And this would be that water balloon bag, okay? So you do an eFAST exam and you see this, and then can you tell if it's normal or abnormal, okay? Let's see this in a bigger view and see the heart pumping. So again, liver here, and you see the heart kind of struggling to pump and kind of not pumping in coordination because you kind of have this huge water balloon around your heart right here, you know? And if you're able to see that and you're able to identify that, then you're able to identify a positive problematic eFAST exam, okay? And that's what this curriculum is built about. Kind of see if you can see normal and then if you're able to identify free fluid in the abnormal sites, okay? And although this is not part of this curriculum and this is out of the scope, you can see how this eFAST exam would be essential, especially if you don't have like a CT scan right at bedside or anything. You could take out an ultrasound, see if they have any free fluid. And the next question for you or your team, clinician, is can you tap this? Can you drain this? Okay. So that's the end of this module. If you have any questions, please feel free to email me or email any of our team members here. Hopefully you're able to review this on your own time and take it piece by piece, kind of see what we're talking about when we're talking about a subxiphoid view, aka a pericardial view, aka a subcostal view. See what normal images kind of look like. Orientate yourself to, can you find the liver? Can you find the heart? Does the heart look normal? Is there fluid, some black anechoic fluid around the heart, and how does that look for the patient? And that's the mainstay of the curriculum here. Again, email me if you have any questions, and we will see you for the next module, online module for the lungs.